mortality rates remain much lower than European countries and the US.
Koronavirüs türünün sebep olduğu hastalık
Turkey's doctors are taking a different approach.
Türkiye'nin koronayla mücadelede ABD'ye gönderdiği yardım uçakları ülkeye ulaştı.
Public health experts are calling on Chinese authorities to be more transparent after a mysterious outbreak of viral pneumonia hospitalized dozens.
We were concerned about this cases, 17 cases of atypical pneumonia in Wuhan, in Hubei province. We were worried about what it is.
Dünya daha önce karşılaşmadığı bir virüs salgınıyla karşılaştı. Ve biz sadece Çin'den gelen ilk bilgileri biliyorduk. Kendi ülkemize gelmeden önce Türkiye Ocak ayında tedbirlerini almaya başladı. Bir defa bilimsel komitesini Ocak ayının 10'unda kurmuştu ve buna yönelik tedbirler aldı.
bir koronavirüs türünün sebep olduğu hastalık bakanlığımız tarafından ilk günden itibaren büyük bir ciddiyetle ele aldığımız bir konu. Dünya genelinde ABD, Fransa, Avustralya, Almanya ve Kanada dahil olmak üzere 23 ülkede vaka görüldü.
The coronavirus pandemic continues to grip the world, with the total number of infected patients topping 50,000 on Friday local time.
Southwest 1860 company pushing out of Bravo 12 is aware that you want to push.
Çin'de ortaya çıkan ve çok sayıda ölüme sebep olan koronavirüsü tüm dünyayı da tehdit ediyor. İstanbul Havalimanı'nda Çin'den gelen yolcular termal kamerayla taranmaya başlandı.
Virüsün ülkemize girmemesi için tedbirler aldık. Bir başka konu, Dünya Sağlık Örgütü bu bir pandemi demeden önce dünyadaki birçok tanımlanmış tedavi modalitelerini kendi ülkemize uyarlamaya başladık.
With attention shifting from Asia to Europe, countries there are struggling to come up with a unified response.
Disturbing new images showing patients on the floor of an overwhelmed hospital.
The death toll in the continent of Europe from the virus continues to rise at an alarming rate.
Televizyonlardan devamlı farklı ülkelerde yoğun bakım yataklarının yetmediğini, hastaların koridorlarda ve hastane dışında yatış için, tedavi için beklediklerini görüyorduk.
The only sound is the urgent movement of the medical teams and the machines keeping the patients alive.
The scale, speed, and scope and magnitude of this pandemic, nobody had envisaged that it will go so fast. And in such large numbers from north to south, east to west. The global systems was constrained all at the same time, whether it was a country like Somalia or advanced country like Italy.
Italian hospitals are at their absolute limit, with hundreds more deaths reported daily and huge challenges in caring for those infected.
Even the most advanced systems were not prepared to address the daily numbers at that level.
More than 14,000 healthcare professionals have contracted the coronavirus in the US, and at least 27 have lost their lives in the service of others.
Tüm dünyanın görünmez bir düşmanla savaştığı bir savaştayız. Her ülke kendi savaş stratejisini geliştirdi ve biz Türkiye olarak da bir savaş stratejisi geliştirdik.
Big news coming out from the World Health Organization.
The WHO officially declared COVID-19 a pandemic as the virus continues to spread rapidly around the world.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Something that is the highest level of alert WHO, based on the current mandate, can give, we gave way ahead in the game in January. Declaring it a pandemic was only issue of semantics. We all told the world, it's only a matter of time before the virus comes to you.
It will come, but what will differentiate is how you respond to it. And that's what we're working with the ministry in Turkey also. That virus will come, but how we respond.
Turkey has a very reputable health system worldwide. We've organized many visits from other countries to Turkey to study the Turkish success story. And Turkey wanted to increase and strengthen its system further because of the coronavirus outbreak. The fast-track operation under the World Bank's fast-track facility for coronavirus. It was a dedicated funding window using the Turkish government's already ready plans. Equipping it in addition with ICU medicines and protective equipment, physicians and nurses. The number, but also the quality of the care that was provided was modernized. Essentially, in order to make sure that depending on the type of scenario, the response would be ready. And this really put Turkey at the advanced level, made sure that all levels of society, rich or poor, were funded. And the vision was about transforming it to the next level, to be ahead, really, of itself. It has become known as a high-quality care system.
Before starting mainland in China, when the first cases of the COVID-19 was named, so we have been come together with the leadership of the Minister of the Industry and Technology and with the well-known scientists in this field on vaccine and treatments, and work on, of course, with on science-based solutions. Especially in March, we started with the work faster in terms of the type of actions will be taken, and we formed a COVID-19 platform. Within 10 days, we started, first of all, 14 projects, and in a later stage, the number has been increased to 18. And within these 18 projects, 8 of them vaccines, and 10 of them for the type of treatments. And each of them has been different. Normal projects takes up to 3 years. But in this case, because of the urgency of the COVID-19, so all the projects are named for the 9 months.
Europe is now the epicenter of the coronavirus pandemic, with cases across the continent.
The number of coronavirus cases worldwide has now soared past 200,000.
Iran is also having major issues. It has the highest number of deaths outside of mainland China, with 8 fatalities.
When Iranian reported the first case, I said, yes, it will be soon in Turkey, because it is just next to us.
Çin'de, Wuhan'da insanların Covid-19 isimli bir virüsten öldüğü haberlere düştüğünde bu bizim başımıza gelmeyecek sandık. Sonra bizde de ilk vaka görülmeye başlandı.
Bahçelievler 11 konuşuyor. Sağlık merkezi Covid pozitif vakamızı Doktor Sadık Onay'a naklediyoruz. Bilginize Bahçelievler 2.
Turkey has confirmed its first coronavirus case and said that the affected person was a Turkish man who had been put into isolation in hospital.
Covid pandemisinin ilk başladığı zamanlarda yatırdığımız hastalar çok daha ağır hastalardı ve bu hastaların pek çoğunu kaybettik.
Every day is a new challenge. Doctors say treating COVID-19 is like piecing together a potentially deadly jigsaw puzzle.
Well, COVID-19 cases are also rising sharply in Turkey. The country currently has more than 18,000 confirmed cases and 356 deaths associated with the virus. President Recep Tayyip Erdogan announced and introduced curfew for the chronically ill and those older than 65.
İstanbul'un Avrupa yakası ve Anadolu yakasında birer tane olmak üzere pandemi hastaneleri kuruldu. Bu hastanelerin her birinin 1008 yatağı var ve bu 1008 yatağın her biri yoğun bakıma dönülebilecek altyapıyla hazırlandı. Özellikle enfekte ve bulaşıcı hastaların yatırılabileceği şekilde çift kapıdan geçilebilecek yoğun bakımlar şeklinde organize edildi. Ve her şeyden daha önemlisi 45 günde hizmete alınmış ileri düzey kompleksler.
After our first case in Turkey on March 11, we faced fast increase also in pediatric patients and also babies born to mother with suspected or confirmed COVID-19. The worst case was a 20 days old baby admitted to our newborn intensive care unit with fever. Mother was positive. Grandmother was positive, and now this baby is still in our newborn intensive care unit. We followed this baby with a myocarditis. We isolated all pregnant women suspected or confirmed with COVID. Delivery was performed in an isolation, negative pressure operating room or delivery room. Also, after delivery, symptomatic babies were taken in isolation room in an ICU.
Hiç unutmadığım bir hasta var. Yaş olarak genç bir hastaydı. Seni uyutacağım ve uyandığında çocuklarınla birlikte olacaksın dedim. Ne olur bana iyi bakın dedi ve evet sana çok iyi bakacağız, söz veriyorum dedim. Onu uyuttuk, mekanik ventilatöre bağladık. Çok kısa bir süre sonra da kaybettik o hastayı. Çok etkileyiciydi. Yani o kadar zor bir süreçti ki. Ben 10 yıldır yoğun bakım hastalarıyla birlikteyim. Ama şu pandemi sürecinde bu kadar ölüme yakın hissettim. İnsanların bu kadar çabuk ölebileceğini gördüm. Çok zordu. Hasta yakınlarına bilgi verirken sürekli gözyaşlarım akarak konuşuyordum. Onlara belli etmemeye çalışarak ama 15 yaşında bir kız çocuğuna annesini kaybedeceğini anlatmak çok zordu.
The effort to save life of this patient and sadness and traumatization after their death also influenced us. At the same time, we had a high risk for infection because we worked with infected patients.
Türkiye'de COVID-19'un kontrolden çıkacağını hissettiğim zaman Nisan ayının ortalarıydı. Bir gecede 100 hastayı hastaneye yatırmak zorunda kaldık. O esnada diğer ülkeler gibi olmaktan gerçekten korktum.
Turkey has more than 110,000 infections. Fatality rates remain low at just 2.5%, much lower than many European countries and the US.
Turkey has one of the lowest recorded fatality rates with 2.5%. This is far lower than many European countries.
Even in case of Turkey, we have seen the mortality has been remarkably low as compared to other countries. Case management, doctors, whatever they are doing in terms of treatment with antivirals or whether it's anti-malaria or whether it's with Zithromax, whatever they are doing is working.
Turkey's doctors say they are taking a different approach to treating COVID-19 than other countries. Instead of putting patients on life support at an early stage, using medicine and high-flow oxygen is more helpful.
Bu hastaların en büyük sıkıntısının solunum yetmezliği olduğunu gördüğümüz için tedavi protokollerimiz hep akciğerdeki sıkıntı başlamadan kan oksijen düzeylerini yüksek tutacak şekilde hareket ettik. Kandaki oksijen düzeyinin düştüğünü gördüğümüz an yüksek konsantrasyonlu oksijen ya da yüksek volümlü, yüksek hızlı oksijen tedavileri vererekten oksijen düzeylerini hep yukarıda tuttuk.
Erken dönemde mekanik ventilasyona bağladığımız hastaların kısa dönemde vefat ettiğini gördük. Bu nedenle biz mümkün olduğunca mekanik ventilasyonu geciktirmeye çalışıyoruz. Şunu da gördük ki yüksek akımlı oksijen tedavisi ve mekanik ventilasyonun gecikmesi hastalara daha fazla fayda sağlıyor. Biz hastalığı takip etmedik, hastalık bizi takip etti. Biz direkt öncesinden tedaviye başladık.
Early diagnosis and treatment of patients can explain our low mortality. The main reason for our success is our different healthcare system than healthcare system in Europe and in America. Our patients have opportunity to be examined in all hospitals, government hospitals, training and research, university, and also private hospitals.
The U.S. now has more reported cases of the coronavirus than any other country in the world.
Coronavirus infections across the world passed the 2 million mark as of this morning, with the death toll rising fast.
Turkey, which had one of the fastest growing coronavirus outbreaks in the world, it's turning the tide. The rate of infection is slowing to its lowest level since the first recorded case back in March.
I think the one factor that can differentiate Turkey from others was having the local capacity. Test was manufactured in mid-February, and together with WHO we had it approved from the headquarters as emergency use. So when the outbreak came, Turkey never faced the glut of testing that you saw even in Italy, in US, in France, Germany. We never had that glut to identify who was infected. Once we were able to identify who was infected, we were able to curtail the transmission chains.
Doctors say one of the reasons that Turkey has done so well is that its medical staff have been quick and nimble and willing to try new therapies. Here they're using a mix of antiviral, immunotherapies and supportive therapies to treat their patients.
İlk başta hepsine hidroksiklorokin başladık ama ek hastalığına göre, akciğer tutulumuna göre ve hastalığın gidişine göre yanlarına başka ilaçlar ekledik ya da hidroksiklorokinden vazgeçip daha ileri ilaçlara geçtik ve plazma tedavisi dahil bütün tedavileri uyguladık.
Two of the drugs has been resynthesized because our Ministry of Health is using these drugs. I mean, it is globally well-known names. It is the favipiravir and also hydroxychloroquine. We use them by importing them, but now we have been resynthesized. So this period is not only giving us to find kind of a solution, but also increasing the capacity for the future as well.
I think first and foremost, WHO never banned hydroxychloroquine. What we said was that till we can analyze the data, no new patients will be enrolled in a clinical trial. But we have to understand, hydroxychloroquine has been in use for decades for malaria. So in that aspect, the safety of the drug is well established. But what the doctors in every country are doing is, and then seemingly in Turkey also, they are modifying the dosage based on the way they are learning. In Turkey, they were using hydroxychloroquine much earlier in the treatment course than in other countries where they were using only at the later stage. And that seemingly in Turkey has reduced mortality. And what we are working with the ministry is that this data needs to come out as soon as possible so that other countries, Brazil, USA, Peru, Chile, India, South Africa, where the outbreak is now seeing its peak, they need to look at these lessons and adopt and prevent all avoidable mortality and disease that we can.
South America is emerging as the new epicenter of the COVID-19 pandemic, leaving hospitals overwhelmed.
There are now more than 5.2 million cases of coronavirus worldwide, with the global death toll topping 338,000.
While most of Europe and the US grappled with high death rates and overwhelmed hospitals, Turkey was able to keep deaths relatively low and its health workers safe.
Türkiye'de hastalığı en erken evrede tedavi etmeye başlıyoruz. Tabii ki hafif semptomu olan hastaların hastaneye yatmasına gerek yok. Bu hastaları evine gönderiyoruz. En ufak bir semptomlarında ilerleme varsa ambulansla hastaneye getiriliyor bu hastalar.
Sağlıkçılar takip ettiler insanları. İnsanlar da kurallara uydular. Kimse başıboş bırakılmadı.
People were able to call in through telemedicine and hotlines to say, I have these symptoms, where should I go? Rather than in other countries where we saw everybody queued up in emergency rooms and hospitals, where unfortunately infection spread much faster because there were many people who were not infected but what we call worried well, came to the hospital and they got infected because through close contact with healthcare system.
Sağlık çalışanları koronavirüsle mücadelede en ön safta onlar savaşıyor. Türkiye'de onlara minnettar.
Biz sağlıkçılar bu savaşın en önündeki neferlerdik. Ama arkamızda da çok büyük bir güç vardı ve o güç bizi daha da cesaretlendirdi. Tüm halkımız bizim için dua etti. Akşamları camilerden bizim için dualar edildi ve halkımız her akşam saat 9'da pencereye çıkıp bizi alkışladılar. Bu destek, bu güç bizi daha da cesaretlendirdi.
Her akşam saat 9'da insanlar balkonlarına çıkıp bizi alkışlamaya başladılar. Hastane nöbetçiydik ilk gün. Her yerden alkış sesi gelmeye başladı. Ne oluyor falan dedik böyle. Cama çıktık, hastanenin görebildiğimiz yerine çıktık. Ya insanlar pencerelerine çıkmış alkışlıyorlardı ya. O anki mutluluğumu anlatamam.
India has the third highest total worldwide, behind the US and Brazil.
India reported more than 90,000 coronavirus cases on Sunday, setting a new global daily record.
Globally, the virus has infected more than 29 million people and claimed over 927,000 lives so far.
Turkey has delivered personal protective equipment to the United States, the country with the highest number of confirmed coronavirus cases in the world.
Turkey has a very strong and rich history of manufacturing. It was very easy to transform the manufacturing belt and start manufacturing PPE.
In recent weeks, Turkey has delivered medical equipment to 3 of Europe's worst-hit countries, Italy and Spain, and the United Kingdom was the latest country to receive medical supplies from Turkey.
So that speaks volumes to the capacity of the country. Same goes for ventilators. So again, the industry was there. All it needed was to change the manufacturing belt line to start producing ventilators. Turkey is again a lesson in terms of global solidarity also. It again speaks volumes to the confidence that the authorities have in the systems in the country. I think Turkey lived the example that Turkey first, but together with the world.
The most vulnerable populations right now are even becoming more visible. The visuals and the coverage of most of the people who are struggling, either because of the health condition, because they don't have the kind of access, or because of the kind of economic impact in certain countries or certain places, it's much more known now. It's much more visible, and I don't think we can walk away as a world, as a global community.
Hundreds of thousands of Syrians living in these tents have survived bombs and 9 years of war.
but now there's an invisible enemy looming large over them.
Syrian refugees are facing new challenges as the war-torn country tries to prevent an outbreak.
When we look at the numbers, Turkey is hosting the largest number of the refugee population in the world in the last 5 years. There are almost 3.6 million Syrian population and 400,000 non-Syrian population. Overall, there are 4 million population hosted by Turkey. During the COVID-19 pandemic period, access to health services are free. There is no the exceptional cases because of the importance of the pandemic.
We have more than 4 million refugees in our country. All of them have been treated as our citizens. They benefit from our healthcare insurance system. They are treated without paying anything. We are doctors, and the most important for us is humanity.